There are several health challenges here in my country. We have a lot of communicable diseases as well as non-communicable diseases and a lot of disaster-related problems as well. We also have limited resources to fund all the possible interventions and assistance to my countrymen. We need to support social innovation in health in order to reach the people who actually need the health interventions, the medicine, or the technology that we already have. Even if we have this technology, we need to have new ways or better ways of delivering them to the periphery. And as far as I know, social innovations in health are the way to go. Behaviors, attitudes, they're actually the ones that are the biggest determinants of our health, because a drug is not effective unless people actually use them.
There's a gap between what we think is the best way of making sure that our outputs benefit the community versus the actual application. And I think social innovation is the key because it's finding creative ways of making sure that research results benefit the community and everyone.
The Department of Health, with the support of other government organizations, private and public alike, have come a long way in improving the quality of care in the Philippines. But I think social innovation epitomizes the principles of primary healthcare because it allows several actors in the community to make use of the resources available to them to make their healthcare affordable, inclusive, and effective. So we started the Social Innovation Hub with an innovation call, and we've received an interesting range of projects addressing issues on affordable health insurance, access to safe and quality care, and using technology to address the gaps in the healthcare system. Our projects came from everywhere, all over the country. So we have a project from Zumaraga, Samar, where they use boats to refer high-risk pregnant women and other high-risk population groups or individuals to a higher tertiary facility because it's an island community. So the project is called the One Health Facility, One Health Boat Project.
When I came to Zumaraga, I was surprised that it had no birthing facility and the facility-based delivery was just at 20%. We live in an island and we should have a facility where our pregnant could go to because there are times that it's really difficult to bring patients to the hospitals, which is an hour away. And so I asked the public health nurse to vacate her office, and her office would be a birthing facility for the RHU. And then we realized that, yeah, we have the facility, but our pregnant don't have the means to come. When an opportunity came in 2012, we proposed for a service boat or a sea ambulance wherein that boat would be stationed in our facility so that every time there is a need to refer a patient, we have a boat, we have a boatman, and we have a fuel so that the patient could be referred in less than an hour. Unlike when we didn't have the boat, the boatman, or even the fuel, it would take as long as 3 hours before the patient could be referred. Then the dream to have a birthing facility in every barangay health station with a boat came into me. It was just a dream. I was just communicating my dream to my fellow doctors. I mean, I wasn't really thinking that they would answer all, but Sir Ron just said that, yes, we would give you 4 boats for your barangay health stations. And really, it changed the way things are going on in the island. Using the boats, and even the health workers would also use the boat to render services in their catchment barangays. It would entail also a lot of expenses. However, we have a possible source of income because every mother delivering in an accredited PhilHealth facility attended by PhilHealth accredited doctors, she is actually bringing 9,550 pesos to the facility. So that is actually reimbursement for the supplies that she used and even a portion of it goes to professional fee for the staff. So it's actually an added bonus. This is sustainable because as long as we are bringing pregnant to deliver in our birthing facilities, we are also bringing more money to the facility so that we could finance more activities for the members, for the people.
Filipinos in nature are innovative, and they find ways to, from the scarce resources that they have, to make sure that they put their health decisions at their own hands. And it's important that they use resources within the community so that they have ownership and better decisions with regards to how they manage their health.
I think there are many people working out there who are doing social innovations, but just don't realize it. And because it hasn't been given that recognition, the ones who are doing these innovations don't get the support that they actually need for their solution to be continued or scaled up.
I didn't know before when I pushed for the project that just addressing access would actually change a whole lot of things in the way services are being delivered, and even on the attitude of the health workers giving the services. It made the facilities accessible. The health workers changed from being not so motivated for now being concerned about the health situation of their community. It really increased their time with the community people because they have a boat at their disposal.
Naiyak ako kasi marami kasi natutulungan na dumating yung motorboat na yan. Marami na natutulungan. Mula nang dumating yan, kaysa noon talaga nangangapa kami kung saan kami manghihiram ng motorboat. Pasalamat kami ngayon na dumating yung boat ni Doktora, inano ng SIHI Foundation, kasi madali na access namin. Mahirap yung wala pa. Minsan naabutan na sa bahay na lang nanganganak. Yun ang pinakamahirap talaga namin.
The ideas and the experiences of the layperson, the public, have to be harnessed because no intervention would work without them. You cannot impose a certain strategy or intervention or even a medication if in their minds it's not acceptable. So we have to create these foundations in the community.
I think what is most important is people understanding the context of Philippine society. So people are aware of how the dynamics, how communities behave, how they work, how the players interact. And these are the people I think who would be most crucial in leading our initiatives in social innovation. So we have to have our social scientists here, our anthropologists, our community leaders, people who work at the grassroots level, on the ground, for us to tell us what they want, what they need. Maybe they're aware of the research, but they haven't really had the chance to talk with the researchers. So maybe having them meet in some meeting forum for them to discuss what are better ways of making sure that these research results reach the community, I think would be very good.
I would like to see the hub as a go-to place for first researchers searching for evidences, because I believe we need to build evidence of social innovations to gain acceptance from the national government and perhaps implement it on a nationwide scale. I want to see it as a go-to place for students who want to pitch in their ideas, because these students they have a radical, ingenious way of doing things, and we want to have that encouraging environment for them to be recognized. I want the Social Innovation Hub to be a go-to place for social innovators to learn from one another and share experiences so that they can move forward. And perhaps a go-to place for entrepreneurs who would like to fund social innovations that would help scale it up to a bigger market or bigger population, with the end in mind of improving the health, not just of a particular community, but of course the whole world.
I'm really more into improving the entire system, trying to address problems in a whole perspective, not just a chunk of it. For me, it's not enough that you have the boats, but you should have the mechanism how to make sure that these boats will be there forever. Because as long as there are no bridges, there will always be a need for boats.